welcome everybody. My name's Dave Heatley. I'm chairing the webinar today. Just as a tiny bit of background, I worked at the Productivity Commission in 2015 on more effective social services inquiry. And one of the things we looked at back then was social bonds. And we were quite keen on the idea as a way of overcoming some of the problems in social services contracting. New Zealand government at the time adopted a policy of actually implementing some social bonds. They had intentions to implement 7 of them. 2 of those got as far as negotiations, and only 1 actually went into practice. And Eyal is going to talk to us about that one today. Eyal is an economist with the Masters in Economics from Auckland University. He currently works at Rangatamariki as an analyst doing evaluations. And before that, he was an MB in Motu. And he's going to have a very interesting presentation for us today. Just a little bit background about social bonds. Essentially, they're a 3-way contract between a government, a social services provider, which is usually a not-for-profit organisation, and a for-profit or organisation, which could be but doesn't have to be, but basically a financier, an investor, someone with some money. And that part of the idea is that third party has some money at stake in the social bond, and therefore acts as a third party they have an interest in making sure that the social bond is successful, and can apply some fiscal discipline to the whole exercise. Essentially, their attempt to deal with 3 problems. One is that there are very weak incentives in typical social services contracting, and those weak incentives mean there's poor incentives to actually measure actual performance and poor incentives to improve on that performance. Secondly, in typical social services contracting, there are low levels of experimentation with different ideas. And thirdly, there is a lack of capital investment, particularly from the not-for-profit organisations that are doing actually delivering the social services. Looking at each of those quickly, the weak incentives problem it's normal. It's typical in social services to end up paying for inputs or judging a service by its inputs. So the number of dollars that go in, or the number of staff that are employed, or something like that. But paying for inputs just gets you more inputs, basically. It doesn't get you better outcomes. A slightly stronger form of incentives is around when you pay for outputs, so the number of consultations delivered or the number of customers serviced. But ideally, what you want is to pay for outcomes. People have better health, better lives, and that contracting for outcomes is a terminally hard problem, it seems. Social bonds doesn't solve that, but it does by put a lot more focus on asking questions about, can we specify the outcomes we want and can we measure them, than traditional contracting methods. And contracting for outcomes gives more room for experimentation because there's because people can try different ways of getting to the same outcome rather than being told, well, you've got to deliver this service with these types of inputs and follow these types of rules. And lastly, having an investor involved of one form or another means that it can potentially get around the capital problem. That not-for-profits are always capital constrained. The only way they can get capital is through retaining previously earned profits, and it takes a long time to build up capital in anything like that, particularly when you're a mission-led organisation that wants to spend money rather than accumulate capital. So that's a bit of a quick background. Take it away, Eyal.
All right, so today I'm going to talk about an evaluation I've done with Phil Spear. We both work for Orang Tamariki Evidence Center, and we looked at the Reducing Youth Reoffending Social Bond. And it says here findings from New Zealand's first social impact bond, but that's a bit of a lie. It's actually the second one, but it's the first one to make it, to be procured and tested. So today I'm going to provide a bit of context, talking about the youth justice system in New Zealand, just a few pointers, because that's where this pilot set in. Mostly repeat what Dave said, social impact bonds. And then we're going to move to the pilot itself, what background about it, findings from previous evaluations, and findings from the latest evaluation that focused on impacts. So maybe imprecise definition of the youth justice system is basically the system that deals when children or young people offend or are suspected of offending. So if you're under 18, that's kind of the system that you're processed through. And police, which is the first responders, they can respond in different ways, which we call proceedings. They can issue the young person a warning. They can divert into what's called alternative action, which is a myriad of things that can include an apology letter, a promise to not offend again, and could be even sending to specialized services. So it's very varied. One level up, we're starting to get into the areas of family group conferences, which are legally binding conferences where the family, the child, maybe even the victim sit together and work out a plan. And the most, I guess, extreme response is prosecution. And in red, you can see the proportion using the youth justice indicators, the proportion of children and young people, the proportion of legal response falling into any one of these categories. And like I said, from a family group conference level and above, that's where Orang Tamariki is being involved. Traditionally, 17-year-olds were considered adults in New Zealand. But since July 19, they were added into the youth justice system. So the age of adulthood increased to 18. And most of those interventions that police refers children and young people to tend to be run by NGOs. So this chart shows the last 10 years of the number of children and young people that offended in blue and red, and the dotted line is their proportion of the overall population. So what we see, there's a big drop both in the number of young people that offended, rangatai that offended, and also the proportion of the population. There is a slight bump at 2020, but that's the inclusion of 17-year-olds. And the last year, we could see that increase here. But overall, there's been a strong decrease over the last decade or so. Next, this chart shows by year the proportion of police proceeding falling into one of these categories. Like I said, alternative action, warning, court, family group conference. And what we see here is in green that the use of alternative actions has increased. So diversionary actions have increased in use by police. Okay, next, social impact bonds. So as Dave said, they are a type of contracting, a way for the government to contract service providers. So basically, a service provider, like an NGO, will run an intervention that tries to address a certain issue. Maybe it's mental health, homelessness, recidivism, but the intervention is not funded directly by the government, but by non-government investors. Could be trusts, banks, whoever. these investors do that because if targets that are met in a contract, if targets that are written in the contract are met, the government will pay them back plus a return. So that means if the outcomes are not met, say like half the people return to school, if this is not met, there's no payback to investors. And to contrast this with what I think of when I think of business as usual type funding of NGOs, of services, is that the government will provide these NGOs or service providers directly. And most times the contract or payments will be based on volume. And yeah, and if you put your economist hat on or think about incentives, being paid by how many people you work with and being paid by meeting outcomes will affect how you run a service. So social bond has been issued globally, quite a lot in the US and the UK, almost 40 countries recorded initiatives. A few international examples regarding youth recidivism, because that's what the New Zealand social bond was focused on, is actually the first social bond to be issued, the one service in the UK. It involved 10 investors and 4 service providers with a funding of £5 million. And the goal was to support young people, 18-year-old males with short prison sentences, reduce their recidivism. So the target that was set in the contract is that the reoffending rate 12 years after release from prison should fall by at least 7.5%. So that's the threshold for investors being paid. And 2 separate evaluations showed that the reoffending rate fell by over 9% compared to a similar group of 18-year-old males that were in prison but did not participate in the pilot. So in this case, in that sense, the bond worked. On the other hand, the Eyal program in New York also involved around recidivism, addressing recidivism, and it was a CBT program of up to 2,000 16 to 8-year-olds that was sentenced to more than 4 days in Rikers Island. They had a goal of reducing recidivism rate by at least 10% in 1 year following release. And the target was not met in the first year, so investors were not paid, and the bond was discontinued. Moving to the New Zealand experience, the Reducing Youth Reoffending in South Auckland pilot. The pilot was run by Genesis Youth Trust. It's an NGO. In 2017, in September, Oranga Tamariki signed an agreement with Genesis Youth Trust, 6 years, taking us to 2023, to deliver a program that reduced the severity and frequency, the reoffending severity and frequency of Rangatai who offended. So it targeted the Rangatai from South Auckland based on the suburb they lived in. And they also had to have a medium to high risk of reoffending. And that was measured by a tool used by police to predict reoffending called the YORST. It had a number of investors that put $6 million collectively to run the intervention. And every 6 months, the reoffending outcomes of participants were measured and compared to the targets in the contract for payment purposes. And for this, the government put aside $24 million and allowed up for 1,000 participants. In practice, just over 600 joined the program. If we look more closely at the referral process, so we got the chart here going from offending, the response of police, as I said, could be warning or prosecution. Then police checks the young person eligibility to the pilot. And if they're suitable, they refer them. And from that point, Genesis gets in touch with the young person. And if they're enrolled, They begin with an intensive period where immediate needs are addressed, a plan is made, and it's following up in a follow-up period of up to 18 months. So overall 2 years intervention, which is a lot longer than business as usual type programs in this space. Just largely repeating what I said. In terms of outcomes, so the goal was to reduce recidivism. And that was measured in the contract using 3 different outcomes. One is a different tool called wireless CMI. It's a tool that assesses the risk of reoffending. So they were distinct, and it kind of converts it into numbers. So a distinct number they had to beat in order to be paid. In addition to that, they were measured against reductions in the severity and frequency of offending that was provided by police. And the targets there were based on historical trends. Overall, yeah, like I said, over 600 participants, largely male Maori, a large proportion of Pacific people, as reflecting the demographics in South Auckland. Average age of referral was the 14th year. 140, so almost a quarter of those enrolled left prematurely, maybe because of lack of contact or because the offending was, they reoffended, but it was so severe, they had to be prosecuted or they had to leave the program. And those who left prematurely were more likely to be male, identify specific people, and had a higher risk of reoffending to begin with. Just a bit more about the targets and outcomes. I'm just showing here in the chart one example. So the bar in blue here shows the reoffending rate, so reoffending per participant, after 6 months, 12 months, 18, and 18 to 24 months after enrollment. So it shows, for example, that for the medium risk group, there was less than 1 offend per participant, 0.88. And we can see that over time, it largely fall up to less than half an offense for every participant. The lines above each of these bars were the targets to beat. And it shows that in every period, on average, the program reduced reoffending below that threshold that triggers payments. And we can see largely the pilot outperformed the targets and investors were paid back. I'll just quickly talk about a few evaluations that preceded the one I'm mainly going to talk about today. So the first evaluation happened halfway through the pilot. It was a qualitative evaluation Oranga Tamariki Commission and focused on the process. It highlighted a number of challenges, like a complex and time-consuming procurement process. There was lack of a formal referral process from police. So in order to get, remember, police were referring Rangatai to the program, but it wasn't always clear for police that they needed to do that. Despite that, staff that was interviewed said that the bond structure helped them feel accountable and target their work into a specific target, to a meeting specific outcome, and that induced innovation. And also because it was a 6-year pilot, having finance for 6 years is unheard of for NGOs. So that helped them with long-term planning. Towards the end of the pilot, a second evaluation that we commissioned looked at outcomes, but from the perspective of participants and their whānau. So we wanted to hear their voices. And they largely, what we heard is they felt supported by staff, both the participant and the whānau. And staff reported similar benefits as in the first evaluation. Like I said, greater accountability, focusing on clear deliverables, multi-year financing, but highlighted the other challenges like the COVID outbreak and other national level events, like the Christchurch shooting. The last evaluation was commissioned by Genesis Youth Trust itself to a company called Synergia. It looked at outcomes using data from the integrated data infrastructure, and used propensity score matching approach to compare outcomes of participants with a matched control group. And they found positive impacts on employment, justice, and health-related outcomes. And a follow-up work estimated that after 6 years, for every dollar invested in the program, there was a social return of $2, and that increased to 12 over participant lifetime. The evaluation we did is closest to the Synergia one, but we use different data sources and methodology. And our goal is to estimate the impact of this pilot on the participant reoffending outcomes. We looked at, because our data only goes for 2 years, the program ended in 2023. So some participants didn't even get to that 2-year period. So we looked at outcomes 1 and 2 years after enrollment. If we remember this process again, we use 2 different data sources. One is the YJ NMDS. It's an integrated database that links correction, Orang Tamariki, and police and justice data, and I think education as well now. From that, we got linked offending and police response information, the type of offending, the date, how police responded, where it happened. And we linked that with the data here, with police data. Police provided us the IDs and enrollment data of participants, and those who were referred but did not participate. If we just look at the outcomes of participants, this is just descriptively, we haven't done anything fancy, no fancy modeling here. We can see that in the 6 months leading to enrollment, the average number of offenses for every participant increased. It peaked at 2 on average for every participant. And in the year following enrollment, the number of offenses dropped. Now, every offense, not all offenses are equal, and Ministry of Justice has a way to quantify the severity of every offense. And the higher the score, the more serious is the offense. So we can see, similar to the patterns of offending, we can see that the severity of offenses increased the closest they got to enrollment, especially in the 6 months leading to it, and slightly fell after, but not nearly as much as in reoffending frequency. So there's some decrease in the severity of offending after enrollment, but not that much. Okay, so quick discussion about our thinking around quantifying the impact of the evaluation. So our starting point is looking at participants, what we call the treatment group. We included in the analysis almost 500 participants, about 80% of all participants that met certain conditions, some of them to do with having valid police ID, data related, had enough. The quality of the data was sufficient. They were Auckland-based, at least 1 year of reoffending outcomes. Now, in order to know for certainty, or 100% to know if the program improved outcomes, we need access to a parallel universe where everything is exactly the same, except this program never existed. If we had access to this parallel universe, we can follow up the participants and see the outcomes in this universe without this program. And then we can compare the same people. And the only difference will be that in one universe you had this pilot, and in the second one you didn't. So any difference in outcomes has to be because of this pilot. But we only have access to one universe, and that's the universe we live in, where participants participated in the pilot. So we have to mimic this alternative reality. And for that, we use a starting point is a comparator pool of over 2,000 rangatai that are offended in Auckland. And we're going to mold this alternative group, this alternative reality, what would happen to a participant otherwise, using a control group from this comparator pool. We use a method called nearest neighbor matching. It basically takes every participant and say, okay, out of this comparator pool, who looks most similarly to you? And once we find that nearest neighbor, we compare the outcomes between the participant and that other person. Maybe the next slide will help clarify what we've done. So we're starting here on the left, and we got in blue here the actual participants. And we need to compare their outcome to some baseline, to that counterfactual. A starting point, we look at our comparator pool that includes Auckland Rangatai that offended. And using that nearest neighbor matching, we compare the outcomes of participants with a subgroup that looks more closely, that looks more similarly to our participants. The outcomes we looked at were, well, the outcomes I'm going to talk about today are all 2 years after enrollment. I'm going to talk about 3 outcomes as the likelihood to not reoffend, the likelihood to offend fewer times, and the likelihood to offend less severely. So we can see on the right, we can see that 46% of participants did not reoffend, and about 2/3 reduced the severity and frequency of their offending. So in the slide before, I said that we're going to compare participants to non-participants that look very similar to them. And this degree of similarity is measured using what we call matching variables. And the list is there. The ones in red, so again, a technical term, the ones in red are variables that we used exact matching for, but I won't get into that. But most of the variables are to do with offending history and Oranga Tamariki history, and demographics. So we want to get as close as we can to apples with apples comparison. And we use matching variables to get to that, and the algorithm to get to that point. The sample that we use is very similar to the official statistics that I showed before, meaning that the sample was largely male and Maori. The average, most of them enrolled at the 14 year. Now, they had relatively few offenses before enrollment, average of 2, and they were not that severe in the greater scheme of things. So these are, most of them are not RAM raiders. These are not the ones you read in the newspaper. This is more like shoplifters, I guess. I mean, there was everybody in that cohort, but on average, these are children that Oranga Tamariki did not deal with because their offending was not severe enough to need our involvement, over 2/3. Now, we talked about the need to make an apples with apples comparison. And the common way in statistics and econometrics to do that is examine what we call as balance. And there's a metric called standardized difference that kind of give you indication, are we in this kind of apples to apples scenario or not? And when we gone variable by variable, matching variable by variable, none of them were unbalanced, which is great. But even with that, there's okay, some differences are allowed if they're small enough. We found that even though it was still in the okay range, participants tended to offend more times and more severely before enrollment than our match control group. This could mean that our findings about the impact of the pilot are understated if you believe that your past will predict your future. We're basically comparing apples with apples that offended fewer times. I don't know what's a good analogy, but you can, I think you get the point. On the other hand, participants were less likely to be prosecuted than than a match control group. And that might have the opposite effect on the results, overstating the impact of the pilot, but I'm addressing those two and how we estimate in alternative specifications. So moving to the modeling results or the matching results, I included quite a lot here. The one in black are using the entire sample. So the first one is just our baseline result. We also use different matching techniques. And we include, I said before that we're using the nearest neighbor, the person that didn't participate but looks most similarly to the participant. We also relax that assumption and use the 2 or 3 or 4 non-participants that looks most similar to participant. So we kind of, the idea is that we hack and stretch and beat the data and methodology quite a lot and look to see if the results change. And from number 4 to 7, this is all about looking at results by subgroups, Maori, non-Maori, removing Rangatai that were prosecuted, and focusing only on counties Manukau, etc. All right, so this chart summarizes the different specifications here and the x-axis, and in the vertical axis, we see the size of the impact. The estimate is measured in red, but it's measured with an error, which is these bars. So just to illustrate what this means, so we have a 0.1 here, and the outcome we look at is the likelihood to not reoffend. So what this means that compared to with our matched control group, participants with 10 percentage points more likely to not reoffend after 2 years. Put differently, what this model indicates is if this pilot didn't exist, additional 10% of the participants would have offended. So if they were sent to BAU services, well, over 600 participants, about 60 additional participants would have offended. And we can see that all these points in red are above the 0 line, which means that the estimate is positive. Participants were always more likely to not reoffend. But some estimations show that the line overlap with the 0 line, and which might tell us that the differences are not statistically significant. So we got mixed results here. It's kind of pointing in the right direction, but it's not always the case that differences are so large that we can attribute them to the program. On the other hand, when we look at the likelihood that the pilot reduced the frequency of reoffending, all the points in red, the point estimates across all specifications are positive, meaning that the pilot reduced reoffending, and there's no overlap with the 0 line. So regardless, doesn't matter how we twist and turn the data and the model, we always found that the pilot was more effective at reducing the reoffending frequency. On the other hand, when we look at the impact of the pilot on reducing the severity of reoffending, we can see that those red dots are much closer to the 0 line. So the impact is estimated to be much smaller, and it's always overlapping with the 0 line. So we don't really have any evidence that the pilot improved reoffending severity outcomes. That is, that it reduced the severity of reoffending. So just to recap, the pilot had 2 goals: reduce the severity and frequency of reoffending, and we had strong evidence that it improved one of these outcomes, reducing reoffending frequency. And quantifying it, like in the example of the likelihood to reoffend, we said it's about 60 additional participants. Because of this pilot, there were 60 additional Rangatai that did not reoffend, or similar number reduced the frequency of reoffending. Is this a lot? A different way to look at it is to measure, and I didn't include it in the slides, but it's available in our paper. It's how big was that reduction? And we found that on average, the pilot participant recorded nearly 2 fewer offenses compared to what would have happened to them if they were sent to BAU. And you take these 2 offenses and you say, well, there's over 600 participants, you get to about, within 2 years, there were about 1,200 offenses avoided because of this pilot. And now you can ask, is that a lot? Is that a little? Well, using the Treasury CBACS tool, the average cost of offending, the nominal in today's dollars, is about, it's over $15,000. That's the average cost for society, both the government and privately. So you multiply these 1,200 offenses by that, and you get savings to the New Zealand economy of over $18 million. So we know that the pilot, well, we don't know, but the findings suggest that the pilot was more effective at addressing reoffending frequency than business as usual type intervention. But we also know that the pilot was more expensive than business as usual type intervention, that sometimes will just mean writing an apology letter to the victim. So the question was worth it? Was this reduced reoffending worth the cost of funding the pilot, the program? This is not a question I can answer here. You need a cost-benefit analysis for that, but I guess the good news is that you can use the results from this study as inputs for a cost-benefit analysis. I think I spoke enough, so I'll leave it with this. These are just a bunch of useful links that I'll share after the meeting today. Thank you.
Thank you, Eyal. Kimi Tangairi asks, is the ethnicity reported here from the young person or from the police system?
The ethnicity we used in the study was from the Ministry of Justice data. So it will be through police records. But what we found that when we compared it to the information we received from the pilot itself, that is based on the Rangatai, they were very similar. And in some cases, identical. I think when we measured things, we slightly underrepresented the Pacific people and overrepresented Maori.
Thank you, Eyal. I'll move on to Sean Hyland's question. He says, you noted that there was some difference in the offence count and the severity between participant and control group, which may affect your results. One way to see if that is the case is through falsification tests. Estimate the impact on outcomes that shouldn't have been affected by the program and check if it is zero.
Yeah, it's a great suggestion. Thank you. I'm going to look at it. The closest thing we've done is, well, we knew there was a difference in severity. So that was one of the specification in the chart. So we broke the sample into those with below the median severity and those above. And we got closer and then we got better balance. But yeah, that's a great suggestion. Thank you, Sean.
Okay, next question, Eyal, is from Dom Madel. He asks, how do investors meaningfully impact on the outcome for whānau? E.g., are there examples of specific actions that they have taken to influence outcomes? So what do they actually,
what do?
What do they actually do?
Yeah, that's a good question. And it's the first thing, that's more like going into the qualitative pieces of work that we commissioned. So from interviews with staff, interviews we had with staff, they said the first thing they've done after the initial assessment is to make sure that immediate needs are met. As a food, and this, in quite a lot of cases, there wasn't food at home. Are there any serious mental health issues? And they had, I think, psychologist, a social worker, and like a mentor in that team. After these immediate needs were addressed, they would write down a plan with goals and that was specific for the change by every young person. And then a lot of it, like getting a driver license, for example, getting back to school. And then, trying to meet all the goals. But there's a lot more. I'm sorry. I can't recall exactly because there's a lot of information about it in the qualitative evaluation. It's just been a few years since I read them. But yeah, the information is there. But basically, like addressing immediate responses followed by tailored plan.
Next question is from Penny Mock, asking, is the data available in the IDI? And if not, is there an intention to put it in there?
Yeah, so one reason why we didn't use the IDI, because at the time the data wasn't available, but since then, good work from Sarah Crichton and others, and Synergia itself, now all that information is available. There are trade-offs for using it in the IDI, but there's a lot of benefits, which are like going beyond reoffending, looking at outcomes of family members, as opposed to just the participant themselves. But yeah, the data is there now, and yeah, available at for anyone to use. Yeah, one of the next steps, if I have the time, is to expand on this work. And it's only we're looking at the outcome of this program, but it's supposed to benefit participants beyond the 2 years mark. I think that you want to look 20 years ahead. So I'm planning, when I have the time to, and some time has passed, to redo it in the IDI, and like I said, look at the impact on family members, on the close community, on different outcomes at a longer time horizon, to really capture the full benefits, and also apply different statistical methods.
Okay. Dom asks, is rephrasing his question, what extra impact is attributable to the financial investment part of the social bond? Wouldn't he ask whether the NGO take those actions anyway?
So the financial incentive, like what role did that financial incentive play as opposed to all the other aspects?
Yes.
That's a great question. The short answer is we don't know, because when you compare this pilot to a typical business as usual type intervention, it's not just the financial incentive that was different. They received much more technology. They were forced to work with a data analytics program. They were forced to use analytical tools. They had 6-year funding, so quite a lot of this was different. And the intervention was 2 years. So it was radically different in a lot of ways, aside from being in a bond contractual agreement. So I guess if you wanted to know for sure, you would have to try a few of them with a few different designs. So you can only evaluate it as a package as opposed to a specific component at this point. But I guess the first step is to see whether it made a difference or not generally.
Okay, moving on to a question from Janet McDonald. What happened now that the pilot has ended? Has funding for the program continued, or is there likely to be an expansion of the program?
The program was discontinued before this evaluation was done. I know the initial plan was to get this evaluation, and that I mean, I would have done it earlier if I knew if the program depended on it. But to do 2 evaluations, and based on the evaluation, decide if to turn this into a business as usual type intervention. But the decision to stop it happened before the evaluation were completed. I think it was more about politics, or the government wanting to do different things, because this was almost a national government initiative. So in the 6 years of Labour-led government, I think they wanted to change their focus on other programs, so that they didn't continue funding it after the pilot period.
That invites a more general question. Are social bonds politically durable?
Well, so far, no. But we only have sample size of 1. But, it's still worth like our argument. There wasn't much appetite for this evaluation at the time. But our argument was that, things come in waves, and maybe the first try, they're not durable, but maybe the experience from this will give confidence to government from, all, from the left and right, that it's worth trying.
Moving on to a question from Tom. How do you think about linkage error when comparing treatment group to the comparison group?
Well, so we had 20% of the sample that we removed, largely because most of it was because we couldn't, if you remember the flow chart, it started with a young person being offended, and then there was a proceeding, and then enrollment. the largest reason for removing participants from the sample is because we couldn't find that proceeding happening before enrollment, and we put a 6 months cutoff. And that was probably the biggest linkage error we had, but I don't think it affected the treatment or control any differently. And when we looked at the characteristics of our treatment group, those who survived that kind of cleaning process, they still looked almost identical to all participants. So, I mean, I don't have an absolute answer, but that sounds to me like a classical data entry error, which will mean that your results are understated. It pushes any differences towards zero.
I'll move on to a comment from someone who appears as P on my screen. Apologies, I don't know your name. They've asked, 3 of the innovations in this pilot, as I understand it, were: first, to spend longer with the participants; second, to provide a longer-term funding with the NGO; and third, more wraparound support. I guess you could say that all of these are common sense, and one would assume that these could have been done before the funding had become available. Is there any chance that this inhibitor will no longer hold? In a sense, is this not about doing anything at all, but more of it? That anything that's particularly different, but more of those things.
Yeah, I mean, 3 of the innovations are about, like investing for a long period of time, and that come with costs and etc. But I think these are things that's worth considering anyway by government. That well, this program was more expensive, but maybe all programs should be more expensive because they're longer term and they're more they have bigger support and they're more data and evidence driven. But there's still the difference that at the end of the day, payments were only made if targets were met. But yeah, there's a lot of common sense here, stuff that I hope that will be adopted more broadly, even if social bonds are not fashionable, as like to consider does it make sense that NGOs have to renew the contract every year? Does that help them with long-term planning and staff retention?
Kimmy has provided a comment saying there was also a pilot named Kotahi Te Whakaoro, in which those innovations are also a focus along with others. And the same services agencies were involved in the past 2 years. That pilot also focused on youth recidivism in South Auckland. Are you aware of that?
I think it's to do with, I think they call it now fast track, not the fast track mining one, but like a circuit breaker where within 24 hours after offending, there's an interagency team coming together and trying to find a solution as soon as they can. I think it's more like for persistent and repeated young offenders. And it started in South Auckland and now expanding across the country. So I think that program is for more I don't know what, more severe offending than the social bond program.
Oh, just to say that no, it was for young people that were picked up before they got into the system. So it was to stop, because you talk about reoffending or offending, that's if the system's deemed it, they've been caught. But Kotahi Te Whakaaro did mahi with identified young people sort of on the pathway towards that. Were in fleeing cars, for example, not the driver, but in cars, for example. And so they would work with them. And the same services, which was OT, police, and justice, Ministry of Ed and also Ministry of Health, work with those families and young people, and they were also supported through Genesis at the same time.
Okay, so I might be confusing programs, but I'll check it out. So yeah. Sorry for the confusion. Yeah.
No, that's okay. There's just, my point is there is lots of interesting work happening in South Auckland, and they're all kind of overlapping, and the fast track is another one, all around this kind of kaupapa and how to work differently with young people in whānau. But those ones are not so much around sort of triggering payment, around commissioning. It's more about whānau outcomes. So they're just slightly different, that's all.
And what wasn't the eligibility criteria for that was young age and also persistent reoffending?
No, they didn't have to. have any offending, they could have engaged in offending behaviour, but not been caught. They didn't have to have any offending behaviour on the books per se with the police. Most of the time it's just warnings, but half of those are not noted, as you will know, working with the police. Most they don't note them, so they're not there. But it's just a slightly different, I guess, angle, not so much around the commissioning and the which is all of these things are good things to be working, you know, together, because it's so multi-complex, and you know, our whānau lives such complex realities. So all these things are good. It's just, it's hard to, because we did some of the work around kotahi te whakaaro, and it's hard to attribute, you know, what is doing what difference, what is shifting where, when there's these multiple things happening across our whānau's lives in the same services and agencies. So just to note that all, but sounds great.
Thank you for that. Tom asked a further question. How long did it take you to complete your analysis, and how many people worked with you?
Good question. Quite a long time, over a year. But I mean, it's not full time on that. There's other projects. But yeah, we had a few delays because we had to wait for police, the data to arrive from police. There's an internal publication process. There was the election, which meant that we had to wait. There's an embargo on publications. But probably for 2 people, you're looking at like actual work, maybe 6 months.
That fits with my my own experience, that anything that involves the IDI requires has a sort of fixed setup cost of probably around 3 months. And which is just very difficult to avoid. Geraldine Wilkins asks, how long did it take to set up the outcomes reportings with the service providers?
So that was before the pilot started. I think that, so first the government developed what they want, and then they went to market and asked, okay, who wants to address this social issue? There was contract negotiation. I can't remember the exact, but we're talking months. I can't remember the exact number, but less than a year. And the signage, like once the Genesis showed interest, I think it was about 3 months, but I don't have the exact number, I'm sorry. But one of the feedback we got from the evaluation is that the process was overly complicated, which could be a reason to why the other bonds were never issued. Might have been just in the too hard basket.
That's really useful, thank you. We're just considering similar requests at the moment from ministers, so useful to have context about time it takes. Thank you.
Thanks, Geraldine. I've got a couple more questions, Eyal. One is around the quality of evidence. We have the gold standard out there as being randomized control trials, and sort of working down the list, you get natural experiments, and you seem to be one level down that, which is using matching. Do you have any broad comments to make about the quality of the evidence base you've got there, and how it might be improved?
At least conceptually, matching is at the bottom of the pile. Is what you do when you can't do anything else. The risk with matching is, like we said, we're trying to compare apples with apples, but even despite, using all the data that we have, it could be where we're still not comparing apples with apples, and we don't have, maybe participants were more motivated than our match control group, and they would have done better than them anyway. So the differences we see are about motivation, not participation in the program, or maybe part of the story is motivation. That's why RCT is so good, because you just randomly assign some of who you want to help with into an intervention and some not. So the issue that we're facing, and I think it's true to most evaluation in the public sector, this is I guess, evaluation literacy in the public sector. For questions like who, where, how much, what you need is data and good data. How many kids offended in this area? And there's a lot of good work done on getting more data and better quality data. For question of does A caused B, does intervention improve reoffending? There's also what you call intervention design features that needed to be done. So that happens at when designing the intervention. And a lot of the time as evaluator comes a few years after, and we rely on luck to whether we can have a robust or less robust results. So I guess a lesson learned for us is, and I guess any evaluator, is to try and sit with the people that design the intervention and help tailor it so you can move up that kind of quality scale towards randomized controlled trials. And one of the advantages of the IDI that I think we might be able to go one notch up from matching, but I'm not sure yet.
Thank you, Eyal. At the start, I said that I introduced in saying that social bonds were an attempt to deal with three different problems. One was around weak incentives for performance, another was around low levels of experimentation, and the third one was a lack of capital investment. What do you think that this particular social bond addressed any or all of those?
Well, definitely capital investment. It was the majority. If you look at Genesis annual reports, that's the funding for this pilot was the majority of their funding. And like I said, they were focused on achieving outcomes as opposed to achieving a certain volume of people to work with. So yeah, I think it's generally, I mean, it's hard to attribute, again, like what aspect of the pilot made the difference. Was it the 6-year funding? Was this good data practices and following evidence-based protocols, or was it the bonds? Yeah, was it a social bond structure? Yeah, you can't tell it, but overall, I think they, holistically touch these points.
Thank you. I think the questions have dried up at this point, and so I'll say thank you to everybody who's participated today. I found this very interesting, and thanks especially to Eyal and to undertaken the hard work of evaluating a complex intervention and the time to report it to us and others. Thanks, everyone.
Thank you.